Well, hello, Dr. Moses and fellow students of HSC 6037, Philosophy and Principles of Health Education. This is my presentation on my health education and promotion philosophy. And before I dive into it, I just wanted to make a note here that this is from a career woman's perspective. I know many of you are quite a bit younger, although I don't think I'm the oldest student in the class, but I do have a different perspective because I only have so many working years left to me, and I am pretty much already established in sort of a baseline with my career, and my goals are a little bit different from what some of the goals you guys may have are. So just wanted to say that right up front. So we'll go ahead and get started. So this is my health education and promotion philosophy. And before we really get started, as I was digging into my own personal philosophy on health education and promotion, I thought first we might want to look at what is my personal definition of health and wellness and how do they interact. So for me personally, health is the absence of illness, injury, or disease. It is treating the mind and body with respect by eating well, staying active, and not intentionally inflicting harm. And similarly, wellness is a state of optimal health of the body, mind, and spirit, and it includes activities that focus on reaching or maintaining a state of optimal health. So wellness influences health. So to put that all together in sort of a philosophical statement, health and wellness for me are inextricably intertwined. Health can be anywhere on a spectrum from excellent to poor, and wellness is the primary means by which health is brought about. Good wellness practices tend to foster good health. Poor wellness practices tend to foster bad health. Health and wellness can best be improved through health education and promotion efforts. So in looking at a personal philosophy of health education and promotion, it is important that we look at our personal history and our lives and see what influenced us to reach the point where we are now. So in my life, when I was 14, my grandmother had a subdural hematoma, which is like a stroke, and she was paralyzed on one side for the remainder of her life, ultimately requiring a feeding tube. She lived for another 8 years, and we cared for her at home. Now understand, these are the days before things like a durable power of attorney and a living will and those sorts of things were common. In fact, you would be hard-pressed to have found one when this happened. So we really didn't have much choice as far as being able to let my grandmother go rather than live a very debilitated life for 8 years. However, they were great 8 years. I enjoyed getting to know my grandmother even more during that time, even though she didn't really know who I was anymore. But in any case, it was a good experience to have, and it is very much a part of who I am and why I do what I do. So throughout those 8 years, she spent some time going in and out of hospitals and also skilled nursing and rehabilitation centers periodically. And with that, as one of her caregivers, I was trained in how to transfer her, meaning from bed to wheelchair or wheelchair to shower, that sort of thing. How to clean and manage her feeding tube, how to provide her hygiene care. So from that experience, I did know that I pretty much wanted to work with senior citizens. I have a very strong affinity for seniors. So then, moving to the next generation, my parents were very active with my brother and with me when we were growing up. We played tennis as a foursome. We jogged around the local high school track that was open to the community. We water skied on the Swanee River, growing up there in Chiefland, Florida, right on it. And of course, we had all the countless lakes and springs that are in this part of Florida to swim in. Among other activities, my brother played basketball. I played basketball a little bit. I was a dancer. So we did a lot of physical activity. We were also musicians, so we My brother and I both marched in the marching band in high school. We had a lot of physical activity that we engaged in. My mom, who is now 81, still lives alone in the middle of nowhere in a very large house north of Chiefland. And this is a healthy 81-year-old woman. She practices yoga at least twice a week in class, not counting what she does on her own at home. I know she gardens frequently in her very large yard. She does most of her own housework to this day. She's very super active. She also always listened to the latest research and tried to make sure that we ate healthy food based on the prevailing theory of the day. Of course, back then when I was a kid, it was more about the food pyramid than anything else. But we definitely abided by that. Unfortunately, this was at a time before anyone really knew what some of the pitfalls of processed foods were. So, I did have a fairly, I wouldn't say high, but a moderate diet of processed foods. But we also grew our own vegetables every summer, being rural and living in a large area, having large acreage. We had our own vegetable garden, and we did everything from weeding to plowing to planting to picking the vegetables, harvesting when the time came, to shelling peas to stripping corn, you name it. So we actually had a large variety of healthy vegetables, homegrown, every year. And since my mother was an educator herself and was off during the summers, she would spend some of the time in the summer canning the excess food so that we would have vegetables that were homegrown through the year, even when we didn't have a garden growing. So my mom primarily is the one that kind of pushed family activity and family healthy eating. It was just part of what we did, and it was something that was expected. And obviously that is part of the area that we have control. Now, my father passed away in 2016 from some complications due to a congenital heart defect. He had a bicuspid aortic valve through his whole life that wasn't discovered until he was in his mid-60s. And a bicuspid aortic valve means it has two valves. Your aortic valve is supposed to have three. So this means over time that valve can stenose or narrow, and it can cause different problems as far as heart disease type problems. It can also cause strokes because the valve will calcify over time, and then your cardiovascular system will throw some of that calcium off to the brain area or into the bloodstream, and it can go to the brain and cause strokes, which my father did have a couple of small strokes, but they were due to the heart defect, and they knew that. That's actually how they discovered it. And then along with that aortic valve issue, he also had a related mild mitral valve prolapse. That's the valve in your heart between your left atrium and your left ventricle. It wasn't real active in him. It was nothing that was major, but because it was defective, it also had calcified a bit when they discovered it. So I'm saying that as part of family history. So the one thing that he was not was diabetic, which was a surprise to most of the people who treated him because he was 6'4" and he weighed around 275 pounds. So most of his medical healthcare providers assumed that having heart issues at a relatively young age, which included atrial fibrillation in addition to the defective heart valve, must mean that he was a diabetic. So a common question at each hospital admission or emergency room visit in his last few years was, how long have you been diabetic? And when he would answer, or we would answer for him, that he's not a diabetic, each time the healthcare provider would check the chart and then respond, "Oh, I see that now. No, you're not a diabetic." Their conclusion was that he had likely avoided metabolic syndrome and diabetes through his active, healthy lifestyle, and that both also contributed to him still being alive for 10 years after his open heart surgery to replace that defective valve. Now, what I learned from my childhood experience is that there really are two factors in your health: genetics, which we have no control over, and lifestyle, over which we have complete control. So I knew even as a teenager that I was going to control what I could to maximize my own health. Now, as a result of the genetic heart defect that my father had, I also inherited a version of my father's issue, but it was not discovered until I was 19 years old. While I was an undergraduate at the University of Florida. I had over the last year or so before being diagnosed some palpitations, some tachycardia, or that's also known as heart racing, just weird feelings in my chest area, and then occasionally some pain as if I was being stabbed in the heart. And then every time I would try to breathe, it was like somebody was twisting that knife in the heart. So eventually, excuse me again, that led me to visiting a doctor because one particular evening I was driving from my boyfriend's home in Bronson to my parents' home in Chiefland. It was a weekend. When I was in school at UF, I actually lived in Gainesville, but my family being so close by, I could go home on weekends pretty easily. So I was driving home from my boyfriend's home. It's about a 30-minute drive, and in that 30-minute drive, I had to pull over 3 times to get my heart back under control because I was in such pain. I thought I was having a heart attack. And I got home and told my mother what was going on, and we made an appointment the very next Monday to see the family doctor to find out what was going on. The result is that I was diagnosed with a moderately severe mitral valve prolapse. Thankfully, no aortic valve issues, just the mitral valve, but it was moderately severe, which was considered pretty serious at that time. Now, I was placed on heart medication, basically a blood thinner, but I decided I didn't want to be dependent on a blood thinner for the rest of my life at such a young age. So the doctor and I worked on weaning me off of it and using lifestyle factors to control that. Primarily staying hydrated, because even to this day, the way I can trigger an episode and have chest pains is to get dehydrated. And the way to stop it or to prevent it is to actually make sure I'm getting enough hydration. So we worked on that, and also some meditative breathing to deal with stress, because stress is also a trigger for mitral valve prolapse complications. So when you have mitral valve prolapse, it is recommended that you have a cardiac checkup done every 10 years that includes a stress test, pretty much on a treadmill for most people, although at certain points they will also do a nuclear med test, a nuclear stress test. But for me, it's only been treadmill so far. So at age 29, at that 10-year checkup, my heart had slightly enlarged, but not significantly, and I was pretty much asymptomatic because I was keeping on top of my hydration, I was dealing well with my stress, and I was making sure I was being active and living an active lifestyle. At age 39, the murmur that you can hear when you listen to a mitral valve prolapse issue, and any other evidence of the prolapse on an echo were negligible. I had gone from a moderately severe case to a mild one in 20 years' time. My physician was a bit mystified, but he attributed much of that improvement to the physical activity and the active lifestyle that I had lived, and the fact that I ate a relatively healthy diet compared to many of my peers in my generation. So it was obvious that you can deal with, I learned over those years that you can deal with a fairly serious health issue and almost really improve it just by controlling the things you can control, which is your lifestyle. So this in turn, all this health experience between my parents and myself led me to a desire to help others live as healthily as they can, and as I age, to help others age well as well. So I started out as a therapeutic recreation specialist. I got my degree at the University of Florida and the College of Health and Human Performance. That degree program is no longer there, but that has kind of segued, it looks like, into this degree program. So that is why I am pursuing this particular graduate degree. So anyway, I started as a therapeutic recreation specialist right out of school, and I primarily worked with seniors for my entire career in a variety of healthcare settings. All of them are focused on seniors and helping them improve their life in some way. So whether helping a home health patient obtain needed services, or helping a senior to transition from home to an assisted living community, or managing a variety of educational and wellness programs in my current position with HCA at Ocala Health, my life has been about helping seniors improve their lives in some way. So based on all of my history, and whether it's my personal history or my work history, this is my philosophy about health education and promotion. Health education and promotion have the power to create a better world where people, and thereby communities and populations, benefit from healthy living, healthy aging, and embracing wellness as a priority. And with that, these are the things I believe. I believe that the ultimate aim of health education and promotion is to improve and sustain the health of people and therefore communities through a variety of interacting processes, which include assessment, planning, implementation, which includes education, evaluation, and research. I believe that healthy aging is a result of healthy living, and that it is within everyone's abilities to strive for a healthy life and live in wellness so long as they have the motivation, education, and skills to do so, with motivation being the primary factor. I can impart information and I can teach skills, but I cannot teach motivation. However, I can provide opportunity to improve motivation by creating interventions that have meaningful outcome. I believe that most people would rather be healthy, but are not always willing to do what it takes to become healthy. In other words, you can lead a horse to water, but you can't make him drink or think. Therefore, I believe in teachable moments, and that knowledge is only useful if it is absorbed, retained, and laid as the foundation for future learning. I believe in fostering optimal learning environments that are a delicate balance between comfort and challenge. Learning does not happen in a vacuum. I believe in using proven processes and tangible or visible outcomes through research and evidence-based practices. I believe that health educators should lead and live by example. To paraphrase St. Francis of Assisi, or words that are attributed to him, preach always, sometimes use words. I believe that the key characteristics for health education and promotion professionals include confidence, trustworthiness, excellence, not just competence, and compassion strengthened with a metaphorical backbone. I believe in each person's right to make his or her own informed decision, right to freedom, and right to autonomy. I only ask that individuals earnestly consider the information and opportunities that are provided. I believe that health education and promotion is the catalyst for change in the healthcare paradigm of the future to a state where prevention is as highly valued as treatment and healing are today. So with that philosophy, I see my role as a healthcare education specialist as being multifaceted. First, as a guide and a mentor, I will design educational and promotional programs based on local community data and pertinent research, focusing on the senior population. These programs include, but are not limited to, fall prevention, golf cart safety, chronic disease prevention and management, medical and healthcare innovations, wellness classes, and physical activity classes. I also see that as an expert on senior and elderly issues where appropriate, I will provide evidence-based insight as to causes of common senior healthcare issues, provide resources for each client inquiry on specific health topics, and direct clients to the proper resource when needed for a variety of senior healthcare related concerns. And lastly, as a role model, I will try to live a healthy life in my own personal and professional lives. I have no grandiose plans for metaphorically setting the world on fire. My ultimate goal is to contribute to the improvement of health in the senior population served by Ocala Health, therefore positively impacting a small piece of the related financial burden, and to ultimately increase that service to the divisional level and serve the senior population in North Florida with programs that address healthy aging. I am not seeking to save the world. I am only seeking to make my corner of the world a little bit better. For this presentation, I used the following references and influential texts. I do encourage you, if you see something on here you've not seen before, take a look at it. Some of them are very short, some of them are quite long, but there is some good information in all of the resources that I used. So please help yourself with that. And I hope you enjoyed my presentation. I look forward to the feedback that all of you may have for me. Thank you so much and have a great rest of the semester.